present our report about features of surgical treatment of temporal regional tumors with epileptic seizures. Seizures are often early and dramatic presenting symptoms of temporal regional tumors. Seizures can cause significant neurological disabilities as well as social restrictions. Seizures can remain after tumor resection, even after total tumor resection. And anti-epileptic drugs cannot assure us in control of focal or generalized seizures. Also, they can cause side effects as well as complications. So, surgery remains very important and sometimes crucial factor of seizure control. The goal of our work was to investigate the need of and optimal extent of resections of temporal lobe with treatment of temporal regional tumors. Our cohort of patients. We selected 26 patients operated for different temporal regional tumors during the last 4 years in the Center of Neurosurgery in Clinical Hospital Philadelphia. About tumor pathology. We had 8 cases of meningiomas, 4 cases of low-grade temporal lobe gliomas. We had 7 cases of temporal lobe gliomas with invasion into insular frontal lobe and other surrounding structures. We separated this group of patients and I'll explain why we did it. We had 6 cases of high-grade gliomas and 1 case of brain metastasis. About seizures. We had among our patients 22 had primary or secondary generalized seizures and partial seizures we had in 4 patients. We were not able to demonstrate any preponderance of type of seizures depending on tumor pathology, tumor extent, or other anatomical or clinical factors. About surgery. 8 patients were operated for meningiomas of temporal region. We were able to achieve total or radicals of total tumor resection in 6 cases. In 2 cases, extent of tumor resection was not so large. And in 2 cases, we performed anterior temporal lobe resection. For cases for low-grade temporal lobe glioma were operated. In all 4 cases, we were able to perform perifocal resection of the tumor, and also we did anterior temporal lobe and hypocampal region resection. 7 cases of low-grade temporal gliomas with insular invasion. As I told you, we were not able to resect these tumors totally because of extent of tumor invasion, and we were a little bit upset of possible post-operative risks. But we did hippocampal resection and anterior temporal lobe resection in all 7 cases. About high-grade temporal lobe gliomas. We also selected these patients into our group, into our cohort of study. That's pretty unusual according to modern literature, because operating temporal lobe, because when operating high-grade gliomas in temporal lobe, we usually focus not on epileptic seizures, but on the extent of life of patients. As well, we could not resect these tumors totally, but in all 6 cases we performed anterior temporal lobe and hypocampal region resection. And in 1 case of metastatic tumor was removed totally, and also we performed resection of temporal lobe. About time of surgery. Resection of temporal lobe usually takes about 8 to 12 minutes in our senior also. So we state that it doesn't influence the general length of the surgery. Also, I would like to represent a few of our cases. First patient is a 32 years old lady that represented with severe generalized seizures, and also she had episodes of sensory aphasia due to the tumor. She was restricted socially, she could not work, she could not provide herself and her family. During investigation, we found that a large temporal lobe, a large temporal region tumor, as it was proven it was meningioma, and I'd like to have an emphasis on a perifocal edema. That lady was operated with anterior temporal lobe resection, and this is a 6 months follow-up MRI scan. As you can see, the anterior temporal lobe is removed totally. This lady after surgery had no epileptic seizures, without any anti-epileptic drugs, and she could get back to work. She became much more active socially, and as I know, she was going to marry. The next patient presented with severe headaches, with visual loss for 1 month, and focal cramps in his arm and face that developed before headaches. During investigation, we found a large temporal lobe glioma, as it was proven later. That's G4 astrocytoma glioblastoma, and was interested. It was situated just in the region of hippocampal gyrus. During surgery, we removed hippocampal region as well as temporal lobe. After surgery, no seizures, no headaches, no focal cramps, no neurological deficit. And the third case that a foreign lady that represented with secondary generalized seizures that she had for about 1 year. She was followed up for a tumor in her temporal lobe with insular invasion. Also, she had very moderate and unspecific headaches. As you can see, I have a tumor in the temporal lobe with invasion into insula. Surely, our goal was not to remove this tumor here, but after removal of the tumor from the temporal lobe and temporal lobe decompression, anterior temporal lobe resection, and hippocampal region resection, this lady stays free of anti-epileptic drugs, free of seizures for about 2.5 years. We had no any complications that could be related to temporal lobe or hippocampal region resection. We had no complications, fortunately, due to prescription of anti-epileptic drugs. 11 patients are staying seizure-free during our follow-up without anti-epileptic drugs. 4 patients have seizure-free, but they were administered some anti-epileptic drug. Usually we use valproic acid preparations. 4 patients have to take anti-epileptic drugs because they have less than 1 seizure in 4 months, so less than 3 epileptic seizures per year. And these cases we estimate as positive results of our study. Totally 80% of positive results. So anterior temporal lobe and hippocampal resection is safe and an effective measure for seizure control in patients with tumors in temporal region. We hope our strategy will protect our patients like these falters.